Hi guys, welcome to this session where we will be talking about principles of pharmacology and pharmacotherapeutics. What exactly is the principles of pharmacology and pharmacotherapeutics is, see, if a doctor needs to prescribe a particular drug for a patient, he needs to have a basic knowledge on three major words. Now this first word is dose, concentration and effect. Guys, have you ever thought that, just for example, if you have an inflammation on the tip of your hands, did you ever think of why do we take the tablet via per oral route? If you say that to a person who is around lots of thousands of years back, he will be laughing at us, right? So if we have an inflammation here, the previous treatment process was apply a drug directly into that area where there is an issue. If you have abdominal pain, just administer some oils there. That seems logical, right? But why do we administer a drug via per oral route for an inflammation which is there on the tip of your hand? That is where pharmacology is. This is what the principle and the basics of pharmacology and pharmacotherapeutics is going to be coming under. And that's what we're going to read up in your general pharmacology, guys. We're going to talk about how a drug is going to be administered into a human body, how that drug reaches the particular area, how it is going to be producing the actions, how it is going to be removed out from the body, because these are all, we used to call them as xenobiotics. Xenobiotics means anything which is apart from what the natural neurotransmitters is involving. Anything which you take up from outside. It might be your food or it might be any biological substances, anything it might be. So what exactly is this general pharmacology and why do we have to have a knowledge on the basics of it? See guys, if you have a clinician, if the clinician has to treat a particular condition of a patient, he has to make sure that he has to choose the most appropriate dose that most closely achieves his goal. For example, if you want to treat a patient with hyperthermia, or if a patient is having fever, and if he wants to decrease the temperature of the body, he has to administer a dose at a correct dose or an appropriate dose which might be decreasing his temperature, right? But how do we administer that? For administering that, the clinician must be having a basic knowledge on three major words which we are going to talk about a lot in pharmacology. And that is dose, concentration and effect which is produced. Dose is the amount of drug which is administered to the patient. Concentration, on the other hand, is the concentration of drug which is there in the plasma of the patient. If you administer 1000 milligrams, it doesn't mean like all the 1000 milligram is going to be gaining entry into the blood, right? Only some is going to gain entry into the blood. So how do we achieve that concentration in the blood? And the last one is effect. Effect means is what the clinician needs. He needs the temperature to be coming down, right? And that is what the effect is. Dose, concentration and effect. As per this whole general pharmacology is concerned, the study of GP can be classified into two major areas. The first one is called as pharmacokinetics and the second one is called as pharmacodynamics. Repeating that, pharmacokinetics, pharmacodynamics. We have many different explanations of these terms, guys, pharmacokinetics and pharmacodynamics. But if you just talk about only two or three of it, which can give you a clear picture of what exactly is that. The relationship between dose and concentration, the amount of drug which is administered to the patient and how much concentration is going to be there in the plasma which is going to be producing the effect. That relationship will be explained by pharmacokinetics. The second one, the relationship between concentration and the effect, the concentration of drug and the effect which is going to be produced. That relationship will be explained by pharmacodynamics. Clear? This is the first explanation of what pharmacokinetics is and what pharmacodynamics is. Now come towards the next second explanation of what the difference between PK and PD. That's what pharmacokinetics and pharmacodynamics we used to call them. PK and PD, the second definition is what the body does to the drug and what the drug does to the body. Pharmacokinetics means what the body does to the drug, how it is going to be playing football with that drug. And pharmacodynamics means what the drug is going to be doing to the body, how it is going to alter certain enzymes or alter the effect which is produced. This is what PK and PD, the second definition is. Let's come towards the third one, which I feel like is going to be the most apt one to say, it's a better one to get a clear picture of what exactly PK and PD is. See, pharmacokinetics, kinetics means what? Movement, right? So how the drug is going to move within the human body, that is called as pharmacokinetics. and how the drug and what happens when the drug is not moving within the body, that will be called as pharmacodynamics. Simply put guys, consider I have an inflammation on the tip of my hand. I take a tablet via peroral route for that inflammation, or you visit a doctor and the doctor prescribes a tablet for you like paracetamol with ibuprofen as a combination, fixed dose combination. And that tablet you take it up via peroral route, right? So from the mouth the drug is going to move into the esophagus, into the stomach, into the intestines. From the intestines the drug will move into the blood, into the portal circulation. From there it moves into the heart, from there it moves into the lungs, again it moves into the heart. I'm talking about this normal circulation which is there in the body guys. So from there it is going to move into your aorta, into the arteries, and here is where the nearby artery is, here is where the artery is, and here is where the inflamed tissue is. From the arteries the drug is going to move into the inflamed tissue. It is going to bind with an enzyme which is responsible for the inflammation to be there. And the most important enzyme, I'm just putting up all the words nowadays itself guys, that is cyclooxygenase enzyme. It is going to bind with that enzyme and is going to be inhibiting the inflammation which is produced there. And once the inflammation has been subsided, the drug is going to move back again into the veins. From the veins it moves into the liver, gets metabolized, it gains entry into the kidney, gets excreted out via the urine. This is the fate of any of the drug which is given via peroral route guys, right? Now in these areas, the study of what all happens whenever the drug is constantly moving within the body is called as pharmacokinetics. Whereas the study of what happens when the drug is not moving within the body is called as pharmacodynamics. What about the drug movement within the body? If we take the tablet via peroral route, it is moving into the esophagus, into the stomach, into the intestines, right? That is not called as pharmacokinetics. Now, the drug is gained entry into the blood, right? So, from the inside the portal blood, it is going to move into the heart, into the lungs, into the heart again, and into the aorta, into the arteries. The drug is moving inside the blood, right? That also is not called as pharmacokinetics. Then what else is pharmacokinetics? Pharmacokinetics means movement of drug molecule from one compartment to another compartment, or movement of drug molecules across biomembranes, which means if the drug is taken by a peroral route, it gains entry into the intestines, right? From the intestines, how the drug is going to move into the blood, that movement is called as pharmacokinetics. Now the drug is there inside the blood, right? It is moving inside the blood, no problem at all. Now the drug gains entry into the arteries here. From the arteries, the drug is going to move into the tissues. It is going to cross the biomembrane. What is that biomembrane? We have the arterial blood vessel wall. We have the cell membrane. The drug is going to cross the arterial blood vessel wall, cross the cell membrane, gain entry into the cell, start producing its effects. How it is going to move across this membrane, that will be called as pharmacokinetics. Now, from the blood vessel, the drug is going to move into the liver to get metabolized. That will be called as pharmacokinetics. And how the drug is going to move from the blood into the urine, that will be called as pharmacokinetics. So the first one is movement of drug molecule from the site of administration. When it is given via peroral route, it is going to be intestines. When it is given via intramuscular route, the site of administration will be muscles, simply put, right? So if we take it the tablet via peroral route, the drug is there inside the intestines, and from there the drug is going to move into the blood, right? Site of administration to the blood, that will be called as absorption. That is called as absorption. The second one, the drug is going to move from the blood into the tissues or organs where the effect needs to be produced, right? And that movement will be called as distribution. As majority of you were thinking, distribution does not mean like the drug is getting distributed throughout the body. No, not that, right? The drug is just getting mixed with the blood. It's not getting distributed throughout the body. Distribution means from the blood, the drug is going to move into the tissues or organs. That movement will be called as distribution. The third one, metabolism. Metabolism means movement of drug molecules from the blood into the liver cells or hepatic cells for its metabolism to occur. We'll be talking in detail about what exactly is metabolism, guys. No need to worry. And how the drug is going to move from the blood into the urine, that will be called as excretion. Four major words: absorption, distribution, metabolism, excretion. All these four together will be called as pharmacokinetics. Is that clear? What about pharmacodynamics, guys? What happens when the drug is not moving within the body? When the drug will not move within the body, buddies, The drug is moving inside the intestines, into the blood, into the arteries, inside the inflamed tissue. It binds with the target enzyme, right? There the drug is not going to move. How the drug is going to bind with the target enzyme, in what bond it is going to form, how strongly it is going to produce in the inhibitions, what are the changes it is going to produce, is it going to be inducing the enzyme or it is going to be inhibiting the enzyme, is it going to induce, or to say it is going to stimulate the receptor or it is going to inhibit the receptor, that how it is going to be performing the effect will be called as pharmacodynamics. And this area, this particular area where we explain the point, right, enzymes or receptors together are called as site of action. These are called as site of action or target proteins. Majority of the drugs which we have tend to target a protein, guys, right? We have only minority, very smaller amount of drugs which tend to target carbohydrates or fat molecules. Majority of the drug is going to be targeting proteins, and that is what this concept is going to be. What are the different types of target proteins which we have? As we can see here, it might be of three major types. The first one is it might be a receptor, or it might be an enzyme, or a transporter. Please guys, if you are not clear cut in this basics of what exactly is pharmacology, pharmacology is going to be a nightmare for you. If we have these basics, it's going to be a sweet nightmare for you. So please make sure you are understanding as much as possible as per the basics is concerned. Clear? Let's talk about what exactly happens whenever the drug is going to be administered by a peroral route. Consider as we can see it in the flow chart here, the drug is administered by a peroral route. The drug gains entry into the stomach. Now from the stomach, the drug gains entry into the intestines, and from the intestines, the drug gets absorbed into the blood, and from the blood, the drug gets distributed to the tissues. And where it is going to get distributed, if it is getting distributed to the target cells, it might be site of action. If it is getting distributed to an area where there is no inflammation, it might be possible, right? The drug is not an artificial intelligence, right? It can't exactly go and find out only the area where it is going to be, where there is going to be inflammation, right? So the drug also gets distributed to a cell where it might not be needed, where the cyclooxygenase type 2 enzymes were not there. So in those areas, it will be stored there. It will be used to call them as tissue storage. And as when it is binding with the site of action, it is going to be producing, and how it is going to be bind with that enzymes, that will be termed as pharmacodynamics. And once the action has been completed, it is going to get metabolized in the liver, and it is going to get excreted out in the urine. Study of absorption, distribution, metabolism and excretion is called as pharmacokinetics, whereas study of how the site of action tend to occur, that will be called as pharmacodynamics. But before all, we forgot to say one important point, and that is the topmost part of this flow chart, guys. And that is what? See, when you administer a drug via peroral route, the drug gains entry into the stomach. Do you think that if you take a capsule, for example, if you take a capsule, do you think that the capsule gains entry into the body as a capsule itself? No, right? There is something else which is happening before that. The capsule shell gets dissolved, right? The molecules get disintegrated, and only the drug molecule tends to get absorbed. The other molecules tends to remain in that, right? So there is one more step which is there before the absorption tends to occur, and that is the pharmaceutical phase. We used to call them as pharmaceutical phase. Pharmaceutical phase includes how the drug is going to get dissoluted, how the drug gets disintegrated. Drug dissolution and disintegration will be learned up with pharmaceutical phase. So we are seeing about three phases, guys: pharmaceutical phase, pharmacokinetic phase, and pharmacodynamic phase. Now, let's talk about an important graph, from which we are going to talk about the basics of pharma, guys, right? This graph will be called as plasma concentration versus time plot. What exactly is this? Consider I have a volunteer, right? I have a volunteer, a normal, healthy volunteer. There is no issues with that patient. We're just going to use him for this study to be done. After getting proper consent from the patient, what we do is we need to find the pharmacokinetic features of a particular drug. Right? So how do we find it out? We ask the patient to sit down, we get informed consent from the patient, we get all the information from that, we screen him, and we make him clear-cut ready for the study to be done. We take up the drug, the test drug to be given, and we ask the patient to take the drug via peroral route with a constant one glass of water. And the patient takes the drug with 1 glass of water. Before taking the drug, what we do is we take up a sample of blood from his body and we send it for biochemical analysis. And we make sure that his blood does not contain any of the concentration of drug previously itself. Right? So we make sure the concentration of drug in the plasma is 0 here now, no problems. Now, after the patient has taken the tablet via peroral route, I withdraw blood every 5 minutes for the first 15 minutes, 5, 10 and 15 minutes. I send it for biochemical analysis and look at how much concentration of drug is there in the plasma. Like similarly, every 5 minutes for half an hour, every 10 minutes for 1 hour, every half an hour for next 5 hours, and every 1 hour for the next 12 hours. Based on individual pharmacokinetic features, we just withdraw the blood and send it for biochemical analysis. And this biochemical analysis, they will be sending back the reports to us, right? And these reports will be containing the 5th minute blood sample which we have sent contained this much milligram of drug. The 10th minute blood sample contained this much milligram of drug in the plasma. The 15th minute contained this much milligram of drug in the plasma. And what we do is we just put up all these values. We have a software for that. If you just put it up, there is going to be a graph it is going to be from, and that is what I am going to explain about right now. And this graph contains two things. We have y-axis and we have x-axis. The y-axis, we are going to plot the concentration of drug in the plasma, which we denote it as Cp. Cp means concentration of drug in the plasma. And in the x-axis, I am going to plot up time. So time means, consider we have 1 hour, 2, 3, 4 and 5, 6 hours continuously. And we have in the y-axis, we have the concentration of drug in the plasma. For this example, I am going to put up 10, 20, 30, 40, etc. It is going to be moving up till the y-axis. Now, the concentration starts from 0, right? Because at 0th time, there was 0 milligram of drug in the plasma. At 5th minute, or for example, for this graph to be completed, at 1 hour, this much milligram of concentration was there in the plasma. At 2 hours, this much was there. At 3 hours, this much was there. And that is how the graph is going to fall up. And at one point of time, it reaches the peak. Why is that peak tends to occur, guys? Consider I am going to give 100 milligram of drug to the patient. Just a single dose. I am not going to treat any conditions, right? Just a single dose of drug I am going to administer. 100 milligram of drug the patient takes. It moves into the stomach, into the intestines, and the drug slowly moves into the body. Not exactly 100 milligram moves into the body as such, right? Immediately it is not going to move. Slowly 1, 2, 3, 4 milligram, it slowly moves into the blood. So the graph is going to be constantly rising up. At one point of time, the concentration is not going to move, right? That's the maximum concentration which can move from the intestines into the blood, and that's why we have a peak concentration here. So once it reaches the peak, after that what will happen? Nothing more. No more drug is going to move into the blood. Only the drug is going to get distributed, metabolized and excreted. That's it. So because of this distribution, metabolism and excretion, the graph is going to fall down, right? The graph is going to fall down and the concentration in blood is going to be slowly moved out from the body. So from this, we can clearly see that we have an increase in the graph and we have a decrease in the graph. The reason for the rise in the graph is because of absorption, movement of drug from the site of administration to the blood. The reason for decrease in the graph is because of distribution, metabolism and excretion. Why is that distribution comes under this process, guys? Because we are calculating what? Concentration of drug which is there in the plasma. Distribution means what? Movement of drug molecules from the blood into the tissues or organs. So the concentration in plasma tends to fall down. So the decrease in graph is because of distribution, metabolism and also excretion. So from this graph, we are going to take up two major values. The first value is the maximum concentration which the drug attains in the plasma. And that maximum concentration, for this example, consider it is going to be some 60 or 70 any numbers. And that concentration will be called as Cmax, maximum concentration in the plasma. And we are going to plot it up directly into the x-axis also, and this is the time taken for the maximum concentration to attain in the plasma. We have a specific term for it, and that is Tmax. We have two major values, guys. We have Cmax and we have Tmax. Cmax is the maximum concentration which attains in the plasma. Tmax is the time taken for Cmax to be attained. Now, this is what the two basic things is. But consider this is not a single drug therapy, right? Consider I am going to treat a particular patient, right? Consider a patient comes to you with fever, right? If a patient comes to you with fever and you're going to treat the patient with paracetamol. You give paracetamol tablets to the patient, the drug concentration slowly rises, the temperature you just see. After 1 hour, you see the temperature is the same one. Consider the patient's temperature is around 101, right? 101 degrees Fahrenheit is the temperature of that patient. So you administer the drug, the temperature of the patient is 101 degree Fahrenheit. After 1 hour, 101. After 2 hours, 101. After 3 hours, it decreases to 100.5. right? Which means the drug's effect has started at 3 hours. Is that right? Is that right? So what do? That 3 hours time, you just plot it up with the y-axis and we find out the concentration which is required for the temperature to start falling down. And that concentration will be called as minimum therapeutic concentration. I'm repeating that word, minimum therapeutic concentration. Similarly, we have a maximum therapeutic concentration, which means if the drug concentration is above the maximum therapeutic concentration, the patient tends to land up in adverse effects of that drug. Right. So, here we have a minimum therapeutic concentration and we have a maximum therapeutic concentration. Clear? And what do? The time taken for the drug to start producing its effects. What's the time in this example? 3 hours, right? That 3 hours will be called as onset of action. That 3 hours will be called as onset of action. And the same line, when it is meeting at the second part of the graph, you just plot it up to the x-axis, right? And the time point between this 3 hours and that point, this time duration will be called as duration of action. Because the time for which the paracetamol tend to act up in that body. See, paracetamol onset of action is not 3 hours, guys. This is just for an example, I am just trying to explain. Clear? So, from this, what are the different values which we have seen? We can clearly see the first one, Tmax, the time taken for Cmax. What is Cmax? The maximum concentration which the drug attains in the plasma. OOA, that is onset of action. We have seen duration of action, and also we have seen about absorption and distribution metabolism and excretion. Apart from all these things, so we have to have one more important knowledge, and that is the area under the curve. The area under the curve is an important value, guys. Why? Because the area under the curve will explain the extent of absorption. Your body is getting exposed to how much milligram of drug, right? The exposure, total exposure of body to the drug, that will be called as that will be explained by the area under the curve. So, AUC will explain the extent of absorption or total exposure of body to the drug, right? How do we calculate the area under the curve? Simple, right? If you want to calculate the area in the room in which you are sitting, it's simpler. We can just go look at your floor, how many tiles are there, calculate the area of a single tile, calculate how many tiles are there in your room. Easily we can calculate the area of that hall or of that room in which you are sitting. But how to find out the area under the curve, guys? Simple. Put straight lines in between the graph and calculate the area of individual trapezoid. That's why we used to have a separate formula, separate model, and that is called as linear or log trapezoidal method is the method by which area under the curve is getting calculated. Now, apart from this, we have this Tmax, right? So, we have this Tmax. We are going to see about only one factor which is going to alter the Tmax, and that is, consider I have two drugs. I have drug molecule A and I have drug molecule B. When I give drug molecule A, the drug molecule A tends to have a faster rate of absorption. This is a newer term for you. Rate of absorption, right? The movement, the rate in which the drug is going to move from the intestine into the blood or from the site of administration into the blood, that will be called as rate of absorption. Drug molecule A has got a faster rate of absorption, drug molecule B has got a slower rate of absorption. Which do you think tend to have a larger, or to say have a bigger Tmax? Is it drug molecule A, drug molecule B? Exactly, drug molecule B will be having a longer Tmax, which means as it is getting slowly absorbed, it takes a lot of time for the maximum concentration to attain in the blood. That's the reason why we used to say that the Tmax and the rate of absorption are inversely proportional. Is that clear? This is the basics of how we are going to treat up pharmacology and pharmacotherapeutics, guys. So, as a summary of what we have learned till now, we have seen about what exactly is pharmacology and how we are going to deal up with this pharmacokinetics, what exactly is pharmacodynamics, and how we are going to explain about the area under the curve, Tmax, Cmax, and we have seen about onset of action and duration of action also, guys. Thank you so much.